Hi, my name is Rab Razzak. I'm a palliative medicine doctor, and I'll be speaking to you today about palliative care. I don't have any disclosures. And one thing I'm sure, I'm sure you recognize is that our healthcare system is broken. Quite often, we have different people looking at the same thing, but seeing their own view, a very limited scope of a person. And the one thing we do know is that there's quite often things that are not talked about. If someone's a cardiologist, obviously, many of them may not talk about the kidney implications of the cardiac issue, or and they may just have a different view or a different lens that they're looking things through, and that makes life difficult at times. And what we do in palliative care is actually we're the antithesis of that. We are actually when we look at patients, we don't only just look at them per se, but their family, their surroundings, the environment that they're in, and we really get to know people. And so I look at our health system as something that's amazing in some aspects. At the same time, recognize that there's ways to improve it, and I think palliative care is one way to improve it, not only for our patients and their families, but also for our healthcare system's health. And so what is palliative care? I'm sure many of you have heard about palliative care, and sometimes that can be scary for some people. For some people, it may be curious. And so palliative care is specialized medical care for anyone with any serious illness. And it's provided by a group of doctors, social workers, nurses, nurse practitioners, chaplains, sometimes pharmacy, and other folks who come together to really care for people. And the focus is focused on helping people with a serious illness, from when they're first diagnosed with the disease to at the very end of life. And the goal is to improve the quality of life for that person, for that individual, and their loved ones, their caregivers too. And again, it can be provided at any age and any stage of disease. So Dr. Hutton, who was a pediatric palliative care doc out at Johns Hopkins, she talked about, palliative care starts at diagnosis, which is sometimes when they are at 20 weeks gestation with support and counseling of families. And many of you have heard palliative care. Sometimes you may equilibrate it to hospice, and these are some of the differences. So palliative care can be seen earlier on in the disease course with someone with a serious illness, and that can be someone with heart failure, that can be someone with newly diagnosed cancer, whereas hospice is for someone who's terminally ill. They have a prognosis of 6 months or less, based on general information that we have. Palliative care, the goal is to improve quality of life, not only for the individual, but their caregivers, and help with their symptoms, and that can be provided along with curative therapies. Whereas hospice is for someone where the goal is to improve quality of life and also reduce suffering, where comfort measures are the focus. And so there are many benefits to palliative care. A lot of folks feel like they have better support. Many say that the communication is much better because it's curated to the individual and families. And so quite often we ask about how you'd like to receive information. And so the information is actually tailored to that individual and family. And often they have better access to services out in the community. And it turns out when palliative care is involved, in many cases, quite often the symptoms are better, their survival is equal or greater, and what we see from some of the financial data is that it actually costs less. So from a holistic standpoint, we focus on all these other things, and what we've done more recently is really helped organizations understand the benefit of investing in palliative care, and the way we talk about that is about cost. And quite often that is because people have better understanding of what they're getting themselves into, and as a result may not necessarily choose things that may be aggressive, but many do. And it turns out that people's hope can actually increase also. And so this was an advertisement about palliative care through the American Cancer Society Cancer Action Network, talking about palliative care because someone with cancer may be a dancer, and what we do is really get a sense of who people are, get a better sense of their values, and really tailor treatments accordingly. And so quite often what happens is when we communicate, we ask about how people like to receive information, and if we ever had a sense of time of prognosis, if that's something that they'd want. And so there was a study done out in Boston Children's where we talked about prognosis. And despite bad news if prognosis was very poor, these families actually had greater hope because they were actually sort of able to take the next step because they know what to expect. And what we do is help manage symptoms with expertise. So some people may have fatigue or depression or anxiety. Some have nausea. And a lot of your doctors may be able to manage some of those symptoms, and sometimes they may not. And what we do is we are very explicit in terms of asking about a lot of different symptoms on a routine basis. So for example, if you are getting cancer treatments from your oncologist, he or she may be so busy talking about the treatments and how strong you are and the side effects of those treatments that they may not necessarily ask you about how your pain is, how your shortness of breath is, if you're nauseous, if you're fatigued, if you're anxious or depressed, or if you're sleepy, or if you slept well, or about your appetite. And what we do is we routinely ask these questions for all the patients that we see. And quite often if people don't ask, sometimes our patients may not tell us. And as a result, we actually manage symptoms better. And so many of your doctors and other providers may speak to us in a certain way. So the old school method was paternalism, where they would say, for example, take these 2 pills, call me in the morning, right? And so I call that paternalism. And that's how some providers were taught many years ago, especially doctors. And many of us were actually taught on autonomy. And in autonomy, quite often people may not necessarily have all the information. So they may say there's these 2 options, but they don't know what the consequence of those actions may be. And as a result, I sort of think of it as like the Matrix, where people may choose a pill and it may take you through a rabbit hole. And I call it the rabbit hole of healthcare. And so it's really important to really get a sense of who people are and what they value so that people can make decisions. And so therefore, what we recommend is a shared decision-making model for communication. So that's getting a sense of who you are, what you value, getting a sense of the things that are important for you, and figuring out some of your goals, and also figuring out some of your fears and worries. And based on all of that, we can make recommendations on best treatments given your situation. We can make recommendations on things to avoid, and so on and so forth. So I think that's something to really recognize. And so there's some important questions to really think about before appointments with your palliative care provider. So some of that could be, how do you like to receive information? Are you someone who likes to hear everything that goes on, or are you someone who likes the big picture? And as information is shared with you, how, do you want people to write things down also to supplement some of that information? Do you want, are there other people who you really care about that should be there? And if there are, you should let them know and bring them to the appointment. And if the doctors ever had, or nurse practitioners or APPs had a sense of prognosis or time, is that information you'd want to know or not? And if you don't want to know, that's okay. What's really important is that someone knows. So if you don't want to know, you can designate someone else to say, you know what, I don't want this information, but I'd like my colleague or my spouse or my caregiver to know. And you give them their name and phone number. And then, I think another question that they'll ask you is, what's your understanding of your situation? And so figuring out what's going on, and they can help translate some of that information that other doctors may have shared with you that you may not necessarily understand. And so sometimes it can be helpful to bring in additional paperwork that you've had. If it's a different institution than you normally go to. So they may have a better understanding of what's going on too. And then I think this is probably one of the most important questions in healthcare, I think, is what are your joys? What brings you joy? And so some people may say, I love sports and I love politics, or I'm really inspired by this writer, or I love this, I love comedy or art. And based on that, they can make recommendations on ways to help you cope. And that brings you meaning, right? And quite often, because a lot of our patients end up being very sick, and they may forget about the joys. And so one thing we want to do is really foster that, to say, these are like emotions you should actually be feeling, or allow yourself to feel. And if you haven't, let's find creative ways to be able to do that. And what are you hoping for right now? And so, some people may find that getting back to doing certain activities that they really enjoy, or traveling, or in our case, I'm a big Notre Dame fan and volleyball fan. So I love playing volleyball and love visiting Notre Dame. Or some people may say, I just want to sort of really calm my brain down. And you can give them other, and then, thinking about things like mindfulness as a guide to be able to help calm things down. That could be an option. And what are your fears and worries about your health or about the future? And some people could say, my symptoms are bothersome, or I'm really worried about time. I'm really worried about these headaches I get. And so the team can actually really pinpoint on those specific symptoms or those specific worries. And some of them may not be medical. Some of them could be, I'm worried about my kids or my family. And so and it'll be really important to bring in all the team members that can actually help with that. And what are some functions that are so critical to you being you that you really can't imagine living without them? And so, I was just taking care of someone who is in her 80s yesterday, and she's someone who loved kayaking in the Ohio River and other major rivers in the country. And she's at a point where she can't do that. And so we had a conversation based on that. That was her minimal acceptable quality of life. So for you, thinking about those things in terms of what are some functions that you can't imagine living without them? What's non-negotiable? So some people say, for me, my cognition is really critical. I need to be able to interact with people. Some say I need to be able to eat on my own. Some say I need to be able to clean up after myself after I've used the restroom or after I've used the bathroom. And some say they need to be independent or be able to walk on their own. And so figuring out what's most critical for you, what are some things that are non-negotiable. I think that's really important. And then, have you spoken to your family about the things that are important for you? And so here's my family, several years ago, and then more recently, the past year. And I've certainly spoken to my wife about this, and I think, and my kids hear me talk about major issues, life issues, and so we talk about the things that are really important for me, and that's something. It's never too late to do. I mean, do this while you're healthy. And so I'm happy to take questions during the during this time. Thank you.